Assalamu alaikum wa rahmatullahi wa barakatuhu. Health check once again on your screens, and still once again Nambale Bashir, your host, to present you with today's program where we learn a lot about our health. We bring medical personnel, different experts regarding different health issues to help us understand and overcome certain medical ailments or problems. With me in the studio today is an eye specialist that is none other than Dr. Herbert. You're most welcome.
Thank you so much for having me.
In the previous episode, we learned about the dry eye syndrome.
That's right.
If I'm not mistaken.
That's right.
In today's program, and actually among the causes of the dry eye syndrome was the gadgets, exposure, overexposure to these gadgets, the phones, tablets, laptops, computers, to mention but a few.
Yes.
Today's program is the digital eye syndrome.
That's right.
How do you briefly explain to our viewer what digital eye syndrome is?
Thank you very much. Now, digital eye syndrome is a group of those disorders that can happen to your eyes after uninterrupted exposure to your eyes for long hours. Uninterrupted exposure of your eyes to gadgets for long hours.
For long hours.
For long hours.
Okay.
Yeah, so there are many conditions that can come out of that. Uninterrupted exposure of your eyes to gadgets for long hours is what we are calling digital eye syndrome.
Digital eye syndrome.
That's right.
Thanks so much, Dr. Herbert. And what actually causes digital vision syndrome?
Yeah, so just like we have defined in the earlier, uninterrupted exposure of your eyes to gadgets. That can be your phone, that can be your computer, that can be your PlayStation, can be any other digital device that you're using. And you have uninterrupted exposure to this gadget for long hours. Some people are on computer or on their phone for more than 6 hours, more than 8 hours in just a day. So those are long hours of exposing your eyes to these rays that are coming from that gadget. So in the long run, you'll get certain symptoms that we are going to talk about. Yes.
Okay.
Yeah.
Thank you so much. In this era we are living today,
yes,
the age we are, you and I.
That's right.
It is very hard one to get rid of
the gadgets.
The gadgets. I mean, gone are the days when in a talk show like this, one would be having a file of papers, questions that I need to ask the doctor who is the guest. But now see, I have a laptop.
That's right.
I have a phone.
That's right.
I can easily get anything from this. So it is hard this age to get rid of these gadgets. How can we prevent this?
So you've reminded me, while when our lower school days, we used to have a motion because that we used to have a debate and had proposers and opposers.
Yes.
And it was about the good and the bad of technology.
Of course, yes.
Yeah. And others were proposing, others were opposing. Technology is actually good. Then others were saying it's actually bad, and they had reasons why. So as much as these gadgets are good, they're also causing some problems. We can't say that they are not, because they are indeed causing some problems. Though they have simplified work, you can work faster, you can work easily than it was before. But because of that exposure again to these lights, it is causing some complications to our eyes. And this is what we are calling digital eye syndrome. So because we are constantly exposed to these gadgets, they're emitting some rays from them, and they're entering our eyes and affecting certain parts of our eyes, including the ones on top up to the ones at the back of the eye. So in the long run, you could have a series of complications due to overexposure to these devices. So that's why we are here today.
So how can one get the good use of these gadgets, and how can we prevent ourselves from contracting or getting the digital eye syndrome whilst using these gadgets?
Luckily enough, especially on the new technologies that are coming up, many manufacturers are putting more extra technology to protect people as much as possible.
Yes.
Yes. So some phones have an application or a software called eye care.
Yes.
When you tap it,
even this laptop of mine,
even
actually,
the laptop has it. So when the moment you feed it in, it changes the contrast of the computer and makes it as low as possible, the brightness as low as possible, such that it is cool on your eyes.
Actually, it adjusts the contrast or brightness depending on the light where you are.
Exactly.
When it is too bright, it will be brighter. When where you are or sitting,
dark,
it's dim or dark, it will be dim as well.
That's right.
Okay.
So that is important technology, because after realizing that some complications are happening.
Well, our esteemed viewer, just as the doctor is explaining to us, you should get the good use of these machines. You know, many of you, it's these machines that bring food on the table. So there's no way you can get rid of them. But you can get a good use out of them. You can learn how to use them the right way. I mean, in our settings, be it the iPhones or Android phones, there is a setting for the eye care. You can set it and it will work as per the condition or situation or brightness of the light where you are sitting. It will adjust depending on the light that you are sitting in. And at night, actually, doctor, I just came to know, even in the laptops, this laptop of mine, there is an eye contrast setting. You can set it that at night, set the contrast to this, still down.
Yes.
It will be giving you that light that is comfortable to your eye. The same applies to the phone. So if you want to use your gadgets the right way, please check the settings of your gadgets, and it is already in the settings.
That's right. Yeah, so that's one of the ways that technology, again, is trying to help technology to prevent problems to your eyes. The other way of trying to protect yourself from this problem, digital eye syndrome, is wearing special kind of spectacles that prevent direct contact with your eyes, these lights that are coming from these gadgets. Yes, so whilst you're wearing these spectacles, you are actually quite protected. Yeah, so many people who have long hours of computer use, we advise you to get these spectacles. In some settings, they're called blue block spectacles or blue cat spectacles. Those are very important for you who uses computer for a long time. Visit any eye center, they could help you.
And what do you advise our brothers and sisters that sit too much on TVs and phones and computers in the dark?
Okay, it's quite dangerous to be in darkness with only one source of light being your computer or your TV
phone.
Or your phone.
Because I personally, whenever I go, it is my habit, actually I'll call it a bad habit. Whenever I go to bed, the last thing I do is to check my phone. Okay? In the dark, because I don't sleep in the light. So how do you advise the likes of me?
So do whatever you want to do while the light is still on. Finish up.
Light well balanced in the room where you are.
Well balanced light. That will protect you from the strain that is going to come after you use the gadget. Yeah, so let there be a well balanced light in the room. Use your gadget. When you're tired, switch off the light and sleep without using the gadget again. That will be better.
If it's bedtime, let it be bedtime.
Bedtime, exactly. It's very important to have enough sleep by then. Some people are having less sleep because they're addicted to the gadgets.
Actually, most of them doing nothing. Most of them on TikTok scrolling video after video, video after video.
So the strain that will come after that, the person will have constantly red eyes, tearing eyes, painful eyes, headache, you know. Those are some of the symptoms that this person
to that very question, to that very point. The next question was going to be, you had started already answering it. Go ahead with it.
Okay.
What are the symptoms?
So redness of the eyes, tearing of the eyes, painful eyes, headache, you know, because of the strain that is coming from the gadgets. The eyes are not relaxing, the eyes are strained. And also the other bad thing that happens when person is over-focused on a gadget is that they will forget to blink. Someone will be there watching for 2 hours, blinks only a few times. They're concentrating or they're doing some work. So because of that, the surface of the eyes also start drying up. Because what distributes the tears over the surface of the eyes is the blinking reflex. The more you blink, the more you lubricate the eyes. The more you blink, the more you... So because you are watching and concentrating on your machine or gadget, you forget to blink. You blink only a few times, and the surface of the eyes would what? Will dry up. So please blink as much as possible while you're using the gadget. Let it be just in your mind. Try to blink as much as possible. Then those are the symptoms that we've talked about. The other way we are handling now everything.
Yes.
So the other way is look away. Try to look away from the gadget.
You talked about that. Actually, I was going to ask you the 20,
20, yeah. So this 23 times. Every time you are 20 minutes into your work on a gadget or using your gadget for 20 minutes constantly, try to look away for 20 seconds. And at a distance of at least 20 meters, look away for 20 seconds and try to blink as much as possible. Relax the eyes, then come back and continue with your work. Do that intermittently every 20 minutes. It will relax your eyes and you'll feel much better as the day goes by.
That requires some discipline.
Yeah, So, but if you can concentrate on you can also have it at the back of your mind that I need to help my eyes.
If you can have the indiscipline of concentrating on a machine for more than an hour, why can't you have the discipline of at least turning away for 20 seconds?
Not much.
Thank you so much.
Thank you.
Now, should I say we're living in a more developed era than the ancient ones, where our children today are also using the same gadgets?
Oh, yes.
For the adults like you and I,
it is understandable.
It is understandable. And you can quite understand the effects or the results of poorly using these gadgets. But I mean, our children today are exposed to the same gadgets.
And they can easily
get addicted, and they won't understand how risky these gadgets are until it is too late.
That's right.
Okay? To reverse the situation. How would you advise the parents and the children at large?
Yeah. We also now acknowledge that there's a lot of learning that is happening on the gadgets. Yeah, the challenge is that the addiction is not on the learning. The addiction now comes on other things like playing games,
cartoons,
watching cartoons, watching movies, and social media.
Yes.
Yeah. So, as much as possible, you're still the parent and you're still responsible for this child. Try to regulate their hours of using these gadgets. You can actually regulate them. TV for 1 hour, maybe play games for 20 minutes, and switch it off, because once they're addicted, they can go whole night playing. They can go all night, and they're affecting their eyes slowly by slowly, but in the long run. There is an important part inside the eye called the macula. It's part of the retina. That part is the one that is responsible for giving us clarity of vision. Yeah, so this light here from these gadgets affects it slowly by slowly. You might find, normally, it gets degenerations when people grow older because of age. But people who are too exposed to these gadgets, this part can get degeneration, not because of their age, but because they are too exposed to these rays that are coming from these gadgets, which is not good at all. Yes, so we can try to regulate it. Otherwise, we shall have very many complications, even in the younger ones, which are supposed to happen later in their life, when they are older.
When should one seek medical advice?
So when should one seek medical advice? Yeah, so there's sometimes after using these gadgets, someone has unbearable pain, and there is fear of light, tearing, headache, a lot of discomfort while using the gadgets. Such a person doesn't need to wait any longer. Needs to come for interventions to be put in place. That kind of person will probably need spectacles to help them, and also need medicines, eye drops to help them, to help the eyes, probably to lubricate them, because actually this exposure also will cause dryness on the surface of the eyes. So we might need to give them lubricants for their eyes, tear supplements, and also wear spectacles for protection. Yes. Yeah.
Talking about the protection, Is this disease or ailment curable?
Yeah, it is indeed.
Can one get rid of it once and for all?
Yeah, it is indeed curable and preventable.
Okay.
Actually, we can now go with the preventable because it is cheaper.
Okay, it is cheaper, yes, but I mean, one has contracted it already.
Yes, one is already exposed. Yes, it is indeed curable.
And what are the procedures? Some of the procedures.
Just need to change a bit of the lifestyle. Sometimes the position of their computers from where they are is also the problem. Some people, they have these high desks and the computer is raised, it is up here. So the amount of strain at this angle is not the same while you are at an inclined angle.
Okay, an inclined angle or the eye level.
At the eye level, that is better. No, there's less strain. It's like primary position.
Okay.
You are not in under much strain. You're not straining the muscles of the eyes. You're not straining the eyes so much, like when it would be if the computer that you're working on or the gadget you're working on is elevated. Okay. So it's very important to adjust the position. You may need to adjust your seat. Maybe it is too high. Okay. Or it is too low. Okay. Adjust it appropriately such that you have your gadget at your eye level. Okay. At an inclined angle. And you do your work more comfortably. Okay. Yes. And then try to put in place the 20-20 rule, 20-20-20 rule. It is just for your own good. So while you cannot leave the gadget, you have to work on the gadget.
And does not require any medicine.
You might not require any medicine.
Does not require any means of, or it will not cost you any money.
That's right. Few things and you're good to go.
Just being disciplined.
Adjusting your lifestyle a little bit.
Okay.
And be disciplined enough to obey simple rules. Okay. And you'll be fine.
20-20.
I would advise everyone that has long hours of using gadgets to buy those spectacles. To acquire those spectacles that protect you from direct contact with these lights from your gadget. Yeah, that is another way of preventing further complications.
Should one put them even during day, or is it advisable to use them only at night?
Yeah, during day is actually much better. The active working hours, whilst you're working and you're using your gadget, have your spectacles on, such that they can protect you as much as possible. Okay. Yes.
So regardless of the time,
of the time,
most people are working, they have shifts. Some are working night shifts and some the day shift. Yeah. So the most busy hours.
Yeah. So as long as you're in your working hours, you're working on your gadget, wear the spectacles. They will protect you. Okay. Yeah, they protect you.
How about if I use them for swag? Is it okay to swag around with them?
Yeah, there are many reasons why people wear spectacles. One can be to improve vision. Okay. Number two, it can be for protection, like we have just talked about. And number three can be for cosmesis. You just want to look good. So. Okay. It is okay. They can still prescribe what is good for your eyes. Okay. And you wear for cosmesis. But in other words, would also be protecting your eyes indirectly. Okay. As you're wearing them, you're protecting your eyes from ultraviolet rays from the sun, which also affect the eyes. You protect yourself. When you're wearing them, if you're doing field work, foreign bodies that have insects flying around, dust particles in the atmosphere, you are protected. If you're doing computer work and you are exposed to the computer for many hours and you're wearing them, you're protecting yourself. So actually, it's a good thing to wear spectacles. Okay. Yeah.
Thank you so much, Dr. Herbert.
Thank you.
Dr. Herbert.
Yes.
Any concluding remarks before we...
Very important to know. Thank you so much. Now, wearing spectacles, you see in Africa, or in Uganda, let me say, because I know Uganda at least. 10 to 20 years ago, if you wore spectacles, in some way you'd be stigmatized. Yes. They would call you names, four-eyed. They would call you professor because they thought only professors are supposed to wear spectacles. Yes. Yeah, but I want to tell people that it's okay to wear spectacles. Yeah, sometimes it is your treatment for your eyes to wear spectacles. So no one should despise you, no one should abuse you for wearing them. And anyone can wear spectacles. Okay. And reasons for wearing spectacles can be from one who is a child to one who is even the oldest. There are many reasons why one can wear spectacles. So sometimes when Even you might have seen such people when they find a child wearing spectacles and say, hey, at your age you're wearing spectacles. What will happen when you grow up? No, anyone can wear spectacles, whether a child, whether a middle-aged man or woman, whether old, anyone can wear spectacles. So do not fear to wear spectacles. When you go to the hospital and they say your condition needs spectacles, don't say, I'm still young. No, anyone can wear spectacles. Yeah.
Okay, wearing spectacles is for your own good. So do not be demeaned by many people that will laugh around for you. Please put on the spectacles, for it's your own good, and protect your eye for the future. It's not only for the elders, but the young ones as well. Everyone needs the eye. It's a gift from God.
Yes.
Gift of sight, that's why Humanity First says or defines it. Sight is a gift. So if you do not protect it, then you are not appreciative towards your Creator who gave you the two eyes to help you go around, moving around with the very beautiful vision. Today's program, unfortunately, is coming to an end at this very, very moment. And I can't go beyond this, but I promise you we still have more programs to come in the future regarding health check. We are not closing. Just stay tuned in. Same time, same day, same hour. Inshallah, next week we shall be coming back with yet more other health inspiring programs. I remain your host, Nambari Bashir. Assalamu alaikum. Till we meet next time.